so today I wanted to talk about vitamin C and its effects on COVID 19. Vitamin C, also known as ascorbic acid, is required for antioxidant defense along with the synthesis of collagen, trypsin, carnitine, and neurotransmitters. The deficiency of vitamin C can lead to scurvy, anemia, loose teeth, bleeding gums, poor wound healing, and skin hemorrhages. Those are only some of the deficiencies symptoms, but there are more listed on the picture on the right. COVID 19 and vitamin C play a significant role together because of how our immune system functions. Now, we need vitamin C for our immune system to function properly because vitamin C is the biggest way of boosting our immune system and is known as a prominent component to fighting colds and flus. A deficiency in vitamin C can cause the immune system to function improperly, decrease the immunity, and leaving us at higher risk for infections and viruses such as COVID 19. Now, vitamin C can vary from person to person as we consume. Some people are able to consume and absorb more than others due to the natural transporters in our body that determines whether or not the vitamin C can be consumed by the cell. In a study by Chalker at the ICU unit, COVID 19 patients have shown to improve and recover more quickly in the ICU unit, the intensive care unit, than those who did not supplement with vitamin C. In this study, including vitamin C and quercetin, into those who are high risk populations for contracting COVID 19, vitamin C was used to prevent and before you are even treated for COVID 19. This alternative that was a cheaper and safer option was used in the study to figure out if these supplements were effective. And overall, we learned that vitamin C was effective and used as an antiviral as it has immune properties that will absorb and make the body more efficient in working against and fighting these viruses such as COVID 19. Now, this is another study listed that used COVID 19 patients who were already diagnosed and added vitamin C supplementation to their care at their time in the ICU unit. Now, we learned that the COVID 19 had improved and they were able to get out of the ICU unit faster than those who were not supplemented with vitamin C. This was a 28-day trial with just observations instead of using ventilation, which is what they were normally using on COVID 19 patients. Some of them were able to try using vitamin C, and some had a placebo to see what was more effective and to see how you can use such supplement as it's a really common and easy supplement to use on the bodies of those who are sick because it's like really light. It's not necessarily a strong drug that can affect their bodies in a negative or positive way with no huge side effects. Now, this is a continued page of the study that was done in the hospital with the ICU unit. And it speaks on how vitamin C is an antioxidant that is super important for our body to gain energy and absorb other nutrients, right? So we want our body's inflammation to go down. And through vitamin C, this would help the inflammation decrease and increase the immunity for the next time that our body encounters such a disease, infection, or virus. So here we see that the functions of the T cells, B cells, and natural killer cells are regulated. And we know that the memory cells would be put to use the next time the body is encountering a virus such as COVID. And this is really helpful because we know that now that our body has strengthened our immune system, this would be extremely beneficial to know that not only will it help us recover from already having that COVID, but it will help us for the next time we may encounter such a virus. Now, we're going to move on to foods and supplements that vitamin C contains. So, the most popular supplements are buffered C vitamins and complex C vitamins. Now, these are names that are thrown around, and just to clarify, buffered C vitamins are vitamin C supplements that have mineral salts added to it. This makes it less acidic. And a lot of the times it's enriched with other nutrients such as calcium, magnesium, zinc, and potassium. While C complex vitamins are C vitamins that are 100% vegan with nutrients added such as amino acid, riboflavin, citrus, and other plant fibers that may be beneficial that contain vitamin C. These pictured here are different types of vitamin C supplements. Right, on the left we have the buffered C supplement we were just talking about. On the In the middle we have the complex C that is completely vegan and contains the different nutrients, and then on the right we have just vitamin C supplements, 1,000 milligrams of regular vitamin C supplements, which is more acidic than the buffered C, and um, they're just tablets that you can take. And moving on to dietary vitamin C supplementation, this is not necessarily supplementation, but you always want to start with diet. And doing this, you can add different foods that are high content of vitamin C. For example, broccoli has 51 milligrams per cup of broccoli. Now, this is really great for adding into your routine if you are deficient in vitamin C or you just need more vitamin C. These are all good sources of vitamin C. So we have cayenne pepper, potatoes, lemons, cranberries, just a lot of options. And another top sources of vitamin C is these fruits and vegetables listed here, nice and colorful. There is strawberries, lemons, guava, bell pepper, oranges, kiwi, Brussels sprouts, cabbages, and tomatoes. Now, the recommendation for vitamin C when it comes to COVID is to increase your intake of vitamin C because this can be really beneficial to preventing COVID-19. Or, as we learned today, that the research shows that it can also not only prevent COVID-19, but it can also help you recover from COVID once you've already had it. Now, there are different ways that you can up your intake of vitamin C, but one way is through diet and all those different fruit, foods, and vegetables we were talking about. A couple we can name are oranges, strawberries, and kiwis. And another way is through supplementation, which can help your body to fight against viruses. and it is recommended to have 75 milligrams per day of vitamin C. And for those who are pregnant or smokers who are in a population that are more prone to vitamin C deficiencies, we want to see at least 110 milligrams of vitamin C. Here I've listed the sources and the different studies used today.